Hi, my name is Nam Jinu, and this is my presentation for final exam. And topic of my presentation is treatment for periodontal disease. Uh, I searched for periodontal disease and its causes and its treatment. At first, what is periodontal disease? Periodontal disease, also known as gum disease, is a set of inflammatory conditions affecting the tissue surrounding the teeth. As you can see, it concludes gums or bones of in your mouth. Periodontal disease is divided into gingivitis and periodontitis, and it's depending on progress. In its early stage, it calls gingivitis, in Korean 치의학영어, and it's in this stage the gum becomes swollen, red, and may bleed. And in gingivitis, inflammation is confined to gums, only gums. And in its more serious form, it's called periodontitis, and in this situation, the gum can pull away from the tooth, and bone can be lost because it rots, and the teeth may loosen or fall out. And in periodontitis, inflammation spreads to the roots of the teeth and to the alveolar bone. And because there are many causes of periodontal disease, because periodontal disease has a combination of various causes, not just one. And first, there is a bacterial plague. In Korean, it's called 치태, and bacterial plague, which is formed by a bacterial attachment to or residual food scraps on the surface of the teeth, continues to occur in everyone and is found not only in the teeth, but also in all soft tissue and tongues in saliva and mouth. There are countless germs in plaque on the teeth, and toxic substance caused by these germs permeates the gums. Also, plaque continues to proliferate and expands to penetration between teeth and gums, and is spreading inflammation. The second cause of this disease is tartar. In Korean, is 치석. Tartar is a dental attachment that occurs when plaque remains in the mouth for a long time and calcifies as a hard stone, but the rough, yes, it makes a surface rough or purpose, and it's has an indirect effect to this disease, but it make easy environment to plug to attach. So it's eventually it makes your gums or around tissues make root. So it's the second. And third reason is specific foods. Foods can also be a big factor. Soft, thick carbohydrate type foods, like you can see like a cheesecake or some gums or caramels, are attached to teeth and help bacteria form bacterial membranes or plugs. And food and beverage that contain sugar, like you can see soft drinks, also have the same effects about forming a plaque. And fourth reason is health problem. Abnormalities in nutritional status or hematopoietic disorder like leukemia and anemia, or immunodeficiency disorder and disorders of endocrine disorders can also be a cause of periodontal disease. Or nowadays, a researcher found there is a genetic problems too. Researchers found that people who have identified abnormalities in the genes on immunity are vulnerable to periodontal disease. Periodontitis is known to be caused by excessive immunity caused by bacterial infections, as I said before. And the genetic abnormalities is likely to cause immunity to become more excessive and develop symptoms rapidly. So a genetic problem is a cause of the periodontal disease too. And some patients are from the same families. Some patients who has this kind of genetic problems are from the same family. So it has been confirmed that there is a possible of inheritance. So now I'm going to talk about the treatment about periodontal disease. Treatment of periodontal disease. Oh, I didn't talk about genetic. Okay. Treatment of periodontal disease is mainly caused by we have to focus the main reason of periodontal disease. Periodontal disease is mainly caused by bacteria, so we have to remove the causes, and it is the most important thing. Since plaque contains a lot of germs, so it is most important to remove the plaque away from the teeth. First treatment is scaling and precutaneous tachycardia. The scaling is a technique to remove plaque and tartar that causes periodontal disease, as we know. And second one, percutaneous tachycardia is also technique for removing plaque and tartar, and it is removing inflammatory factors embedded in the root surface on the teeth. Difference between each is scaling is removing tartar or plaque on the surface of teeth or gums, but precutaneous tachycardia is removing that kind of tartar or plaque inside the gums too. And second one is gum surgery. Gum surgery can be performed to ensure removal or of plaque or tartar, which is not removed from by scaling or precardial surgery. This surgery is even deeper. As you can see, during this gum surgery, this man have opened the gum under the bone, to the bone. So it is a much bigger surgery. And last thing is bone transplantation. If the alveolar bone is heavily absorbed, the bone can be transplanted during gum surgery. And there are many types of bone transplantation, including the patient's own bone, as you know, self bone or heterogeneous bone or composite bones. So when our bone under our teeth is heavily wounded, we can do the treatment for teeth. For example, we have foundation for implant, but if our alveolar bone is heavily wounded, it can't be set firmly. So we have to transplantation the bone for the next surgery. And as we know, there is a lot of treatment for periodontal disease, but periodontal disease treatments create an most important thing is environment and manage our mouth condition well. So we make sure there is not many plaques or tartar, so we cannot get a periodontal disease. So we can take a brush or teeth. We have to brush well and some tools to remove tartar and plaque in our normal life. And it is the most important thing to cure the periodontal disease. And this is my presentation, and thank you for watching.